I'm Tom Freeman, family physician from London, Ontario, and the past chair of the department in London. My recollection of Ian actually goes back to when I was a medical student. Was made aware that when I was a second-year medical student that he was giving a series of seminars in the basement of the old St. Joseph's Family Medical Center entitled A Quest for Holism, in which he was educating essentially the faculty and any interested individuals around the concepts of more holistic thinking, which was a concept that he further developed as things went on. I was very impressed by those evening seminars and had actually written him a letter as a student. This was out of character for me, but I wrote him a letter because I was interested in the topic and it coalesced with some of the things I was reading at the time. And he actually wrote me back, which surprised me, and we met and talked a lot about some of the concepts that he was developing. So I was very impressed, and I mention this because he was, one of the characteristics of him that I think needs to be emphasized is how humble he was. He was a man of great humility, even though his contributions to family medicine are well known and very important. He was a very humble man, and I saw this demonstrated again when I visited him one time in hospital when he was hospitalized for an intestinal problem. And in this post-operative period, a nurse had come into the room, and when she was telling him what he needed to do, when she needed to turn him or so on, I mentioned to him that he was Dr. McWhinney from the Department of Family Medicine, and her response was, well, she looked at him and said, well, how does it feel to be on the other side? And in his usual humble way, he just said, oh, I've been here before. And I think it emphasized to me again the degree to which he never was full of himself in any way. And later on, I was a part of a group who was invited to give some seminars on patient-centered method in the United States to an HMO there, and Ian was among our group, of course. And we were entertained, of course, at that while we were there for 2 or 3 days in between doing the workshops. And Ian you would always find him in close conversation with medical practitioners from all over the place that were attending the conference, and he was constantly seeking out their insights and their experiences. And so I think those are just 3 examples that come to my mind that demonstrated to me that not only was his insights and his intellectual rigor in terms of defining our discipline so important, but also his humility in engaging people that sometimes don't get engaged very well.